My name is Brooke Levy. I'm the Executive Director of the Down Syndrome Network of Montgomery County. And again, I'd like to welcome you. We're very excited to have Dr. Melissa Parisi with us this evening. And the presentation, obviously we're talking from research to results, how discoveries from the Down Syndrome Include Project are making a difference for families today. And I just wanted to go through a few housekeeping bits before we get started. So this presentation is being recorded. If you could stay on mute during the presentation, that would be great. We welcome cameras on so we can see participants. And if you have a question, please put it in the chat. And Joy, who I'll let her, Joy, why don't you go ahead quickly and introduce yourself too?
Hi, welcome everybody. I'm Joyce Stein. I am the program coordinator from the Down Syndrome Network of Montgomery County, and I'm thrilled that you're all here tonight. I will be monitoring the chat box. So, if you put questions in the chat, I will pass them on to our speaker.
Great. And with that, we also have closed captions enabled. If you would like to click on live transcript, it'll show subtitles or closed captions. If you could keep questions general and not have them be specific to your loved one with Down syndrome, that it would be most appropriate. And then if you can see here that we have a link here that you don't have to copy or anything, because we'll put it in the chat. We do appreciate all evaluations for our presentations because we do actually use them to make our presentations better in the future. So please let me welcome Dr. Parisi. She is the Chief of Intellectual and Developmental Disabilities Branch at the Eunice Kennedy Shriver National Institute of Child Health and Human Development, the National Institutes of Health. Dr. Parisi earned her MD and PhD degrees from Stanford University, followed by pediatric residency and fellowship training at University of Washington. She joined the NICHD in 2008 and currently oversees the Intellectual and Developmental Disabilities Research Center program. She chairs the Down Syndrome Consortium, a public-private partnership to facilitate research collaborations. Through this consortium, she led efforts to create DS Connect, which is part of why we are here this evening, the Down Syndrome Registry, an online database that connects families with research opportunities and resources. She also leads the Include Project, a trans NIH initiative to address quality of life needs for those with Down syndrome. She strives to advance basic, clinical, and translational research for individuals with developmental disabilities. So with that, I am going to stop sharing and I am going to hand it over to Dr. Parisi, and she's going to start sharing. And I know that several folks have introduced themselves, and I just want to say thank you so much for introducing yourselves. Hi, Hina, it's so nice to see you, and Tess, Emily, Mare, and gosh, there's a lot of people here tonight. Tracy, oh, it's so nice to see you as well. Joanne, Sarah, and I think that I addressed the rest. So thank you for coming, and welcome for those of you who didn't introduce yourselves in the chat as well. We're so happy to have you. So with that, Dr. Parisi, please share your slides.
All right, let me put this in presentation mode. Try one more time. Can you see it, or do you need to switch the settings?
I can see it.
We don't see my
notes
off to the side.
Yeah, we see the notes off to the side.
Okay, I can switch that. Okay,
there you
how
go.
about now?
Perfect.
All right. Well, thank you all so much for the invitation. And, I love talking with this group because, we're like, I'm in your backyard. I live in Montgomery County myself. I work at the National Institutes of Health, and it's always a pleasure to talk with you all, even if we can't be in person. Zoom is the next best thing. And I'm hoping that today I'll give you some more information, some updates on a really exciting new research program that the NIH is conducting, really focusing on Down syndrome. So thanks again for the invitation. This is me. And this is what I want to talk to you all about, the NIH. And I imagine that many of you know a little bit about the NIH since it is in your backyard. And then I'll talk about the Include project and then some specific research projects that are transforming care for people with Down syndrome. And then finally talk a little bit about DS Connect, the Down syndrome registry. And a special shout out, since we're in the month of May, happy Cinco de Mayo tomorrow for those of you who celebrate that, but also happy Mother's Day for all of the mothers on this call who have allowed us to be a part of your journey as well. So special call out to moms. So the National Institutes of Health. This is what the big building looks like on main campus off of Rockville Pike. And this is the US's National Medical Research Agency based in Bethesda. We are the largest funder of biomedical research in the world. And our budget is for this fiscal year, which started on October 1st and goes until September 30th of 2023, was a staggering $47 billion with a B dollars. So we fund a lot of research in a lot of different areas of human health and development. And we're going to talk a little bit more about what we're doing for Down syndrome. The NIH is made up of 27 separate research institutes and centers, and many of those focus on sort of body parts. Like there's an institute that's looking specifically at heart-lung disease. There's another one that focuses on muscle and skin disorders, and so on and so forth. But the thing about Down syndrome is that it's not just one part of the body, right? It's the whole person, and that's what makes it kind of unique. So when we fund research at NIH, most of the money that we fund is not for research that's happening on our main campus off Rockville Pike. It's actually going to universities throughout the country and sometimes internationally to fund the research that we support to advance health and wellness for people in the United States. But that research funding is very competitive. And even though we have a lot of money that we're putting into research, there are a lot of people that apply to NIH for funding who don't get funded. And the only way they get funded is by putting in an application and undergoing a process of peer review and getting a good enough score to get funding for that research project. So a lot of people don't get funded, but we try to fund the best of the best. And our peer review system typically works reasonably well, although we can't fund absolutely everything. So I think that I'm probably preaching to the choir, and I would imagine that most of you do care about research, but just to make that point even more clear, I've shown a couple slides here, and this graphic on the left, can you all see my mouse or no? Can you see my pointer?
Yes.
Okay,
Yes.
great. Oh, that's good to know. Okay, so the research has shown that in the past 50 years, there's been a dramatic difference in outcomes for people with Down syndrome. And 50 years ago, congenital heart disease was actually the #1 cause of death for people with Down syndrome, and oftentimes in infancy and childhood. But now in 2023, the #1 cause is actually dementia and Alzheimer's disease. And we'll talk a little bit more about that in a few moments. And likewise, if you look at the number of people with Down syndrome in different age ranges, so in 1959, life expectancy was about 9 years of age, and now it's about 60 years of age, and we're hoping to increase that. But if you look specifically at some of these age ranges, and you look at the higher age ranges, which are these kind of colors here at the top of this graph, there weren't that many adults with Down syndrome in the 1950s. In 2010, the proportion of adults living with Down syndrome has gone up dramatically. And part of the reason why is because we've actually developed better treatments for congenital heart disease for kids with Down syndrome. In fact, the outcomes are so good that many kids actually do quite well and live to adulthood. And that's why it's so important that we do the research we do. And now we have to tackle some of these aging issues for people with Down syndrome. So the new NIH research plan for Down syndrome, I want to pop this in here just so I didn't forget about it and let you know that it's now available, publicly available. If you want to download all 166 pages, and I know it's 166 pages because I've read and reread this thing millions of times, but just to let you know that we are very intentional about our Down syndrome research. We have goals and objectives that reflect public input. We're really trying to increase diversity of investigators, what we call principal investigators or PIs, and research participants. We have a whole new section on training so that we can have the next generation of investigators who are going to be studying Down syndrome. And we've got a very detailed portfolio analysis that covers the prior 7 years and almost 600 articles mentioned there that have been funded by NIH research. We even include a section on COVID-19 and Down syndrome. So check it out and let us know what you think. We're always open to feedback. So now I'm going to pivot and tell you about the Include project. So this was launched in 2018. It's now 5 years old under a congressional directive to address the critical health and quality of life needs for those with Down syndrome. And one of the unique aspects of this program is that it's really trying to focus on some of those conditions that we know affect people with Down syndrome. And the hope is that by studying these conditions in Down syndrome, we'll be able to help people with Down syndrome and also understand these conditions in the general population as well. And so things like Alzheimer's disease, autism, cataracts, celiac disease, congenital heart disease, diabetes, and many others are more common in Down syndrome. And we hope to learn about these conditions in Down syndrome and help inform treatment strategies for people with Down syndrome in the general population. In contrast, some conditions are less common in Down syndrome, like many forms of cancer and certain types of heart disease. And if we can figure out why people with Down syndrome are protected from these conditions, that can also help us understand these conditions in the general population, maybe give us clues to ways in which we can help treat those conditions in everybody. One of the other goals of this project that I alluded to is that we want to increase the number of investigators and trainees who are studying Down syndrome, because as investigators get older, they may retire, and we want to make sure that we have a strong pathway for young investigators to be encouraged to study Down syndrome. And finally, diversity has become a really high priority for all of our programs at NIH, and Include is no exception. And I'll talk a little bit more about that in the future. Okay, so the Include project, we really like to use acronyms at NIH, and we have a lot of them. Sometimes we have so many acronyms that we can't remember what they stand for. But I can tell you that for Include, it's easy because it builds in some of the priorities for the program. So Include stands for investigation of co-occurring conditions across the lifespan to understand Down syndrome, capital E. And it's really formulated around 3 different components, and 3 is just a magic number in my mind, and it's easy to remember. And so I really like the way that the program is configured. So the first component is basic science oriented. So that's like studying cells or animal models or trying to understand what is going on with that extra copy of chromosome 21. The second component is building a large cohort of individuals with Down syndrome across the lifespan for comprehensive analysis and biomarker evaluation. And what we mean by that is we want to be able to study people over their lifespan, and we want to be able to study what's going on for them with their Down syndrome. Are there markers, biomarkers, like in the blood or urine or skin, that can help us understand what risks they have for developing some of these co-occurring conditions and what things might protect them? So that's really the cohort basis of the project. And then finally, we want to have a component that looks at clinical trials, current clinical trials, future clinical trials. And this is so incredibly important because in the past, people with Down syndrome have been routinely excluded from participating in clinical trials. People with intellectual disabilities in general have been excluded. And we recognize at NIH that that's not okay. And we need to give people choices to participate in research that's meaningful for them. And I put the URL of the link to the project on this slide. So if anyone wants to look it up, they can certainly go there, check out the research plan, check out some of what we're funding, check out what we're doing. So this is the money slide, quite literally. And this tells you a little bit about Down syndrome research funding across NIH for the past decade, plus or minus. So if you look at this green bar on the left, this is really all of the research, the baseline research in Down syndrome for the last, from 2011 to 2017, has been around $20 million per year for Down syndrome research, which isn't that much for a condition that is as common as Down syndrome is. There are more rare conditions than Down syndrome that get a lot more research funding. So in 2018, with the Include project, we started bumping up the research funding for Down syndrome, and that's what's indicated by this darker blue bar. So 2018, we started with investing an additional 23 million on top of the about $20 million, 37 million, I should say, in that year for regular Down syndrome research. And the amount of funding for Include has gone up considerably, so that in 2022, which is the year that we just completed on September 30th, we had total funding of $113 million, and 75 million of that was all from Include, and the rest was other funding from different institutes and centers across NIH that's not specifically earmarked for Include. So that total research is the most that there's ever been for Down syndrome. And it's really remarkable. It's allowing us to do so much more to understand and help people with Down syndrome. So if you look at all of the projects that have been funded by this blue bar over the last 5 years, we've invested $258 million on 270 new projects for Include. So we're really excited about these numbers. So, okay, what can you tell me now about what Include has done for Down syndrome? And now that we're 5 years in, we're starting to see the benefits of this investment. Keep in mind that it takes a long time for research findings to be translated into medical care. And I know that's really hard to hear, and it requires a lot of patience on your part as families and our part as investigators. But we're starting to see some benefits, and I want to tell you about some of those exciting projects. This is a little bit of a summary of the breadth of what we're doing. We funded studies to look at the impact of COVID-19 on individuals with Down syndrome and their family members. We're looking at the causes of leukemia in children with Down syndrome. We know that leukemia is much more common in infants with Down syndrome. It's a particular type of leukemia. We're trying to validate cognitive measures in something called the NIH Toolbox, specifically for kids with Down syndrome, so that we can use these standardized measures to understand how a child's development is progressing. We're looking at how kids with Down syndrome acquire language and how they articulate and express themselves in as clear a manner as possible. We're studying what causes congenital heart disease in infants with Down syndrome, because about 50% of kids are impacted with it, but 50% are not. And then for those that do have congenital heart disease and have heart surgery, does that impact their neurodevelopment and their behavior? And then finally, and again, this is just a very big sampling of those over 250 studies that I was referring to. We are trying to look at biomarkers that will help us predict neurodegeneration and the risk for Alzheimer's disease in adults with Down syndrome. So that's a lot. But let's take a little bit deeper dive into sleep apnea, because this is an area where I think we're really starting to see some really nice returns on investment. So I bet most of you are familiar with sleep apnea, but this is a really common condition, particularly in children and even in adults with Down syndrome. And it's really that inability to breathe clearly during sleep. And it results in reduced oxygen in the bloodstream. And, you know, less oxygen in your blood means less oxygen in your brain. So that can impact learning and development. And then kids who have apnea, they wake up frequently to sort of, you know, take a deeper breath or to reset their airways so that they can more clearly breathe. And so frequent wakings are not really good with getting sustained, restful sleep. So the form of sleep apnea that's most common in Down syndrome is obstructive sleep apnea, or OSA. And this is when there's a blockage in the airway. And I'll tell you a little bit about what that means. And, you know, at least half of all children with Down syndrome have sleep apnea. So, and up to 3/4 do. In comparison, those without Down syndrome only have a prevalence of sleep apnea of about 1 to 4%. So this is significantly elevated in children with Down syndrome. And there are a lot of causes for it. Some of it is the differences in the facial structure, some flattening of what we call the midface, narrowing of the airway in the nose and the throat. That just means that there's less of a large enough cross-section of the breathing tube to be able to get the air into the lungs. Low muscle tone, hypotonia, that contributes. Coordination of airway movements may be a little bit off for kids with Down syndrome. Another big one is large tonsils and adenoids, those lymphatic structures in the back of the throat that could get really big and block off your airway. And certainly having a large tongue and a tongue that kind of flops back because of low muscle tone can also cause sleep apnea. And then frequent respiratory infections where you have a lot of congestion and secretions, or reflux from the stomach contents into the throat can also contribute to OSA. And the consequences, for those of you who may have children or infants with this condition, as you know, can result in irritability, behavioral problems like temper tantrums, problems with learning, just because they're not feeling rested and able to concentrate. And long-term, this can increase the risk of heart disease and something we call pulmonary hypertension, where the pressure in the lungs becomes great, and it just impacts cardiovascular health in general. So we are funding a number of studies looking at sleep apnea. And one of the investigators, Dr. Ignacio Tapia, is trying to figure out ways in which we can measure sleep apnea. The American Academy of Pediatrics recommends polysomnogram, which is the gold standard hospital-based sleep study that some of you have been tortured with, I'm sure. And the problem is that it's really hard to get accurate measures of sleep in a hospital setting. It's not your natural home bed and sleep environment. And we know that if you can't get a really accurate measure, it means that, the reliability of treating sleep apnea could be in question. So there's really been a lot of interest in home sleep studies and whether or not we could figure out a way to study sleep apnea using a setup like in this boy who's getting set up to go home and get his sleep study done in the comfort of his own bed, and trying to correlate whether the findings from doing a home sleep study versus the gold standard polysomnogram in the hospital, how well do they correlate with regard to something we call the AHI or apnea hypopnea index? And you can see that, particularly in some of these lower numbers of AHI, and by the way, anything over 5 to 10 is actually abnormal. So that there's actually pretty good correlation. So maybe we can get to the point where there are home sleep studies using equipment from a clinic that would allow kids to be tested for sleep apnea in a little less invasive way than being in the hospital. Another study that's been led by Dr. Tapia and some of his colleagues has been to look at whether or not there are ways that we can improve treatments for sleep apnea after kids have gotten a diagnosis and have had, in many cases, their tonsils and adenoids removed. So that's usually step one, is like, let's get rid of that big balls of lymphoid tissues that are blocking the airway in the throat and see if that helps out. But it doesn't always help. And so kids have to go to positive airway pressure, sometimes known as CPAP or PAP. And one of the strategies that Dr. Tapia and his colleagues are looking at is whether they can figure out ways to make it easier to tolerate by kids who need PAP to help with their sleep apnea. And this little girl, this is a picture from one of his subjects in his study, was so excited about her PAP machine that she was just, jumping up for joy. There's another study that we're funding to Dr. Susan Redline that is looking at whether or not oxygen therapy could be a good treatment for sleep apnea. So, even if we remove the tonsils and adenoids, there's still a lot of kids who still have obstructive sleep apnea. And so she's doing what we call a randomized controlled trial of oxygen supplementation during sleep. Can we give a little bit of oxygen, just enough to help keep that airway open so that we reduce the incidence of sleep apnea in these kids? And can it improve their cognition, their ability to think and learn? Can it improve their cardiac function and their quality of life and sleep measures? And so when we call randomized, it means that some of the people who enroll, and this is kids between the ages of 5 and 17, are going to be randomized to getting oxygen, and some are just going to be getting like air without the oxygen, and see if that makes a difference, if we can tell the difference, because the kids and the families don't know which one they're getting. So this is kind of the gold standard for clinical trials to help us figure out whether an intervention is really making a difference for the individual who's being treated. And then I have one more study looking at sleep apnea using something called a nerve stimulator. And this is called a hypoglossal nerve stimulator. So there's actually this nerve that kind of is underneath the neck and the tongue, and it helps push the tongue forward. So when we speak, we're using our hypoglossal nerve. We're doing all kinds of things that activate this nerve. But as I mentioned before, sometimes kids with Down syndrome have a really floppy tongue, and it kind of blocks their airway when they're sleeping. So you can put in a stimulator, and you can see on this X-ray, it's this device that's implanted in the chest. It's not in the lungs, it's on outside the rib cage, but underneath the skin. And it has an electrode that goes up and basically stimulates the hypoglossal nerve to push the tongue forward. And you can turn it on and off. So you turn it on when the person goes to sleep, and then you turn it off in the morning because you don't need your tongue to be stimulated to move forward when you're awake and talking and eating and doing other things with your tongue. So this is a novel therapy for sleep apnea in adults and children. And this particular study, being led by Dr. Hartnick and Dr. Skotko in Boston, is really trying to see, can we do this safely in younger individuals with Down syndrome, 10 to 21 years of age? And can we see whether or not this will improve cognitive abilities and expressive language? And the reason why they're doing this study is because when they did their initial pilot research and tried to test whether or not children with Down syndrome and teenagers, because it was only approved initially for older ages, they were noticing that families were saying, you know, our child's language is really improved once he got the hypoglossal nerve stimulator. And so they were wondering if maybe having better sleep, treating the apnea, and maybe even strengthening the tone in the tongue might actually improve speech articulation and cognitive abilities. So they're doing this study now, and too early to see what the results are, but it's one that we're really excited about as well. Okay, another study that we're funding is something called the Down Syndrome Health Instrument. And this was to an earlier stage career development, earlier stage career investigator, Dr. Stephanie Santoro. And so she's really trying to develop a measure to help understand the health status of those with Down syndrome, and she's calling it the DHI. And she's been doing focus groups with caregivers, family members, individuals with Down syndrome, and experts on Down syndrome to really figure out what are the important measures in the domains of mental health, physical health, and social health that can be measured for people with Down syndrome, so that when we do our clinical trials, we can figure out if we're making a difference. If we don't have good measures, then we can't figure out if what we're doing is making a difference. So this is really important. And some of her initial work has just been published last month in the Journal of Intellectual Disability Research. Transitioning to another aspect of neurodevelopment that's important for people with Down syndrome is ADHD, or attention deficit hyperactivity disorder. And we know that ADHD is more common in children with Down syndrome than in children without Down syndrome, but we don't know if the medications that we typically use for kids without Down syndrome can work the same in kids with Down syndrome, or the doses, do they need to be altered? So Dr. Anna Espenson and Tanya Froelich are doing a study of stimulant medication in children with Down syndrome and ADHD. And this was a two-part study. In the first part, they were really just trying to define, how can we figure out what ADHD looks like in Down syndrome? It might look a little bit different than it does in kids without Down syndrome. So they've completed that part of the project, and now they're looking at short and long-term efficacy and safety of this methylphenidate, which is a standard treatment for ADHD in kids with Down syndrome, and whether or not this will improve quality of life, behavior, and functional status. And very recently, they added 2 additional sites. So now they have 4 different sites around the country that are enrolling kids with Down syndrome and ADHD to see whether or not this medication is effective for them. And then we have a project looking at autism in Down syndrome. So this is a project that's being led by Dr. Tager Flusberg and Nelson, and they are trying to understand this co-occurring autism that happens in about 15 to 20% of those with Down syndrome. And we know that one of the earliest manifestations can be communication delays, but that's also a problem for kids without Down syndrome, or excuse me, for kids with Down syndrome who don't have autism. So they're really trying to figure out, can we diagnose and identify autism in kids with Down syndrome in the first year of life? And they're using one of these cool little EEG caps. So this is a little baby wearing one of these little caps that has all these scalp electrodes. They're not actually going into the scalp in the brain, but they're on the surface. And this helps measure electrical activity of the brain and can help us figure out which kids are developing signs and symptoms and risk factors that are associated with autism and Down syndrome. Okay, this next study is really interesting. So this is led by Dr. Joaquin Espinosa at the University of Colorado. And he was interested in trying to treat skin disorders in Down syndrome. I think many of you know that there seems to be an increased likelihood for people with Down syndrome to have autoimmune conditions. This is where the immune system basically attacks the person's body when it should be doing that. And there are a number of examples of autoimmune conditions that are more common in Down syndrome. This includes celiac disease, diabetes, particularly diabetes mellitus, thyroid disease, hypothyroidism, and alopecia or hair loss. And so here's an example of a young man with 17 years old who has alopecia areata. That means that he has no scalp hair. You see a few little faint tufts of maybe some follicles, but essentially he has complete hair loss. And Dr. Espinoza wanted to see whether an FDA-approved drug known as tofacitinib could treat these autoimmune skin conditions such as alopecia. So there's this measure that helps you assess how severe the alopecia is. So this young man had a really high score on this measure of 86 because he had no skin. And then over time, after 16 weeks of treatment with this medication, he had really remarkable improvement. And the study team, with his permission, also called him Ed Sheeran just because he looked a little bit like the rock star Ed Sheeran, particularly with his red hair and the pattern that had recovered in this young man. So this is a really nice, interesting story of ways in which a pretty well tolerated and pretty safe immune drug actually helped with the skin condition in this young man and in many of the individuals who've been treated for this condition. Now, what happened is that something that they weren't expecting at all. They also did a few little tests of cognition and neurodevelopmental assays and wanted to see how the people were doing before and after they got this drug to treat the immune system on something called the NEPSI. And this is a test where you're asked to draw a line connecting this car to the finish line. And so most of us, within a very short period of time, would be able to put a pencil to paper, and on this track, we'd be able to trace the line, a single line across it. Now, this person was a little bit perseverative, and they were coloring it in, and it took a very long time for them to reach the finish line. But this was before they started the drug. After they started the drug, for the skin condition, they were able to do the task really well and really efficiently. And here's another example of someone who was just coloring it in and not being able to accomplish the task. And then after 16 weeks of treatment, they were able to basically copy that path really efficiently. And so what this led the team to do, in particular, because there was one subject who was suffering from Down syndrome regression disorder, and they said, can we use this treatment because this person had a dramatic improvement in their regression when they started this tofacitinib? And they're like, oh my gosh, maybe this immune system suppression drug might actually help with Down syndrome regression disorder. So Dr. Espinoza, along with Dr. Santoro, Jonathan Santoro, who's in California, are now just going to be starting a clinical trial for young adults and teenagers with Down syndrome regression disorder. And they're going to be comparing this drug, tofacitinib, with immune globulin, IVIG, and kind of the standard care, which is a benzodiazepine known as Ativan, and see which of these treatments might work best for individuals who seem to have regression disorder and might have an immune system involvement in that condition. So this is really exciting stuff. And this is why we do research, right? Because sometimes we learn things that we weren't expecting that help us figure out new strategies and new treatments in domains that we weren't even planning on studying in the first place. And then finally, I want to talk to you about Alzheimer's disease and Down syndrome in terms of studies that I want to highlight from the INCLUDE project. Now, we know that many people with Down syndrome begin to show signs of Alzheimer's disease when they're in their 50s and 60s. And the reason why we think people with Down syndrome are at increased risk of developing Alzheimer's disease is because chromosome 21 has this really, really important gene known as the beta amyloid precursor protein gene. And so this makes a protein called amyloid. And for reasons that are not completely understood, but people with Alzheimer's disease, whether or not they have Down syndrome, have an increase in amyloid that gets deposited in their brains. And this is what causes the memory problems and a lot of the issues in Alzheimer's disease. there are other things that happen after amyloid as well. So I don't mean to imply that it's just the amyloid that causes dementia, but it seems to be at a very early stage in the disease progression. And so people with Down syndrome have 3 copies of this gene rather than the 2 copies that most people have who do not have Down syndrome. So with having 3 copies, your body and your brain is making more amyloid that it can't process properly. And so we know that amyloid deposits earlier in the brains of adults with Down syndrome than it does in adults without Down syndrome. I'm hearing some noise. Okay. So we have been studying this project known as the Alzheimer's Biomarkers Consortium of Down Syndrome, or ABCDS project. And it's now in its 8th year. We've invested $105 million over 5 years. We're looking at over 400 adults with Down syndrome and some of their healthy sibling controls. And these are adults over 25 years of age. And we're studying all of these different measures of cognitive function, as well as looking at blood studies, genetic markers, brain scans, to figure out what are the risk factors for development of dementia in these adults with Down syndrome as they age. So this is a really important longitudinal study that's helping us understand this phenomenon. But at the same time, we're doing some other studies too to try to understand aging and Down syndrome. And another project is looking at risk and resiliency factors for Alzheimer's disease and Down syndrome, things such as diet and exercise and social attachments. All of those things can also influence the trajectory of developing Alzheimer's disease and may actually help delay the onset of dementia. So those are very exciting studies as well. There's another clinical trial that's testing preventative treatments for dementia in adults with Down syndrome, and it's using some of the subjects who are enrolled in the ABCDS project. And we're going to be starting the first clinical trial of an anti-amyloid medication in the Down syndrome population, probably sometime this summer. And then finally, there's another study that's looking at treatments to improve cognition in Down syndrome, using a medication that's actually used to help stimulate the blood cells to produce and make white blood cells. So some really exciting projects that, again, early days, we don't have all the answers yet, but stay tuned for more information as things progress. So this is a list of all of the clinical trials so far that have been funded by the Include project. And I've already mentioned some of these to you. I'm not going to go into great detail on these, but some of these with the asterisk were originally awarded in fiscal year 2019. So almost 3 years ago, and they're now transitioning from their preliminary phase, we call the R61 phase, to the more complete recruitment and enrollment phase known as the R33 phase. So this means that they've been able to move from their early initial studies into the second round, where they're doing a more detailed and usually a large pool of participants to really try to understand some of these conditions. So I think that I've implied, although I haven't said it explicitly, that sample size is really important. And the challenge that we have is having research participants with Down syndrome participate in these studies. So we can fund all the projects in the world, but if we don't have enough people volunteering to be a part of these studies, then we're really failing in our efforts to understand Down syndrome. And so this is just a very small illustration of this phenomenon and the importance of a sample size. So if you're able to sample the entire population, you'll see the diversity of little blue, green, red, yellow, orange people here indicated on this slide. But if you just have, and in this particular population sample, 14% of these stick figures are green. If you just take a very small sample of, say, 5 of the individuals from this larger population, you wouldn't believe that there are any individuals, any stick figures that are green or yellow, because they weren't sampled adequately. So there are real risks in only having a very small restricted sample size for your research studies. That's why we need larger studies with more diverse populations to really understand the breadth of the co-occurring conditions in Down syndrome. And so one of the ways that we're trying to do this is through the Include Data Coordinating Center. And this is really a resource that is also being funded by the Include project. It's really trying to take all of the studies that we're funding on Down syndrome research and put all of those cohorts together into one database. It's all protected information, so there's no personally identifiable information. But if a researcher wants to say, gosh, I wonder if there is genetic data or genomic studies or biomarker studies on adults with Down syndrome. How many have been studied that have deposited their data into the single data resource? They can go to the Include DCC and look that information up. And they can then sometimes go to those investigators who are studying these different aspects of Down syndrome and maybe request biospecimens or request collaborations or develop new hypotheses for new studies. So this is a resource for the entire community. And it's not just for investigators, it's also for families and parents too. Anybody can go to the Include DCC website and look at some of the data and, you know, do a little playing around, see what you might find. The other thing that we're trying to do is trying to provide education to families about Down syndrome and some of the research that we're doing. So we have a clinical trial seminar series, and we had our first webinar that was held in November on assent and consent. Our second webinar was just a little over a week ago, and it was Let's Talk About Clinical Trials. So it talks about the types of clinical trials, reasons to get involved, roles of families and caregivers. We always have perspectives from self-advocates and family members. So we had Dr. Tomey present on Let's Talk About Clinical Trials, and then a young man with Down syndrome and his mom also presented about his participation in her research project and her studies. And then we really try to target this to everybody. And this is going to be available and posted on our website. And I'll make these slides available if anybody's interested in, you know, look at these in the future. And I'll try to make sure that we add the link to the video cast. So if you want to know more about clinical trials, it's a 1-hour webinar. It's free and available for viewing on the NIH videocast site, but it takes usually a week or two before those things are available. And I don't think it's posted yet. And then finally, we really want to encourage diversity, as I mentioned earlier. So we hosted a virtual workshop in September, and we basically are trying to expand the diversity of participants with Down syndrome in research, as well as researchers and the trainees. And we had over 300 attendees on this video webinar 2-day workshop. We had simultaneous Spanish interpretation. We had a lot of representatives. We had a lot of self-advocates who participated, and we were able to provide honoraria for families who provided their perspectives. So we're really trying to put our money where our mouth is and really engage the population. And we're going to have a diversity, equity, inclusion, and accessibility webinar series that's starting June 26th. And we're going to focus on our outreach to underrepresented populations with Down syndrome. So to wrap up my presentation, I want to tell you a little bit about DS Connect, the Down syndrome registry. And I know I've spoken about this before, so for some of you, this may be review, but I'll try to give you a quick update. So DS Connect is a confidential and secure registry. It's all online, and it's designed to collect information about people with Down syndrome to connect them with research opportunities of interest to them. It's also available in Spanish, and there's a professional portal as well. So what can you do if you register and put the information about your family member with Down syndrome into the registry? So you can look at the data yourself and say, gosh, I wonder how many people have sleep problems. And when we pulled the data for this particular slide, 35% of people acknowledge that there's sleep problems in their family member with Down syndrome. And the vast majority, over 500, had sleep apnea. So, you know, we've been talking about how common some of these conditions are. And here we have some actual data that has been crowdsourced. This is data from families about Down syndrome. And that's so valuable for us and for investigators to be able to learn about it. There's information about healthcare providers. And
I'm on the Zoom meeting.
this again is crowdsourced. We have over 860 medical providers listed on DS Connect, and you can search by city or state. You can search by specialty. If you move and you're like, oh gosh, I really need a cardiologist for my child with Down syndrome, and I'm moving to a new state or a new city, you can look up and see if there are others that have been recommended by family members who are part of DS Connect. We also have healthcare recommendations that are linked on the website and that are age appropriate. So if there's a child who has Down syndrome and is registered in DS Connect, we send you links to the AAP the American Academy of Pediatrics checklist. If it's for adults, if you have an adult with Down syndrome in your family, then we link to the global medical care guidelines. We have links to some of the other NDSS related guidebooks for aging and Down syndrome. So we're really trying to provide resources to families. So it's not just you giving us your information, it's us giving something back. And then one of the things that we've added fairly recently to the registry is a link with all of the NIH-funded clinical trials and clinical studies related to Down syndrome. So you can search by location and by age range and figure out if there's a study that you might want to sign up for or participate in. We also support professionals who are interested in using DS Connect to recruit for their studies. And the way this works is that we never give your personal information to investigators, but we serve as a trusted liaison. So if somebody sends me an email and or an investigator fills out our web request and we approve it, we have a committee that actually reviews all of the requests for access to DS Connect. And then we will send an email to all of the participants who fit the criteria for what that research study is looking for and say, are you interested in signing up for Dr. So-and-so's research study? If so, here's a link to the webpage, or here's the email of how to reach out to them to register or to at least explore whether it's something that you might be eligible for and interested in. So in the last 7 years, we've helped 100 studies with recruitment support. Over 90% were approved by our review committee, and 15 include projects have received recruitment support, including 5 of the clinical trials that I shared with you earlier. So I think it's just really important to remember that research takes a lot of different forms, and sometimes it could be a survey, a questionnaire, an activity tracker data, participating in a clinical study, doing a clinical trial, being in an include study. All of these are research, and it's all up to you. It's always the family's choice whether or not they want to participate. And it's the person with Down syndrome who's able to give assent and consent, depending on their age. So we're really trying to reach out and increase recruitment for DS Connect. We have a goal of having 10,000 participants by September, which is the 10-year anniversary of the resource. We're over halfway there, but we still have a ways to go. So if there are materials that we can provide that would be helpful for you, if you have questions about the registry, please feel free to write to us or send us an email at our dsconnect@nih.gov website, and we'd be happy to share those with you. So just to kind of bring things to a close, I just want to let you all know the guiding principles that we think are really important for the Include project and for DS Connect. I mean, we really want to respect the rights of persons with Down syndrome. We always try to use people first language. We try to really ensure that when you give us information, we are respectful of that information. We don't share it with other people if it's private information, but we do share de-identified data. That's data that has the identifiers removed so that everybody can benefit from your participation in research. We really are committed to increasing diversity of research participants, and we know how important it is to have outreach to families. So for these reasons, we've been partnering with as many advocacy groups as we can. We go to a lot of events. Here are some of my colleagues, Dr. Sujata Bardhan, David Egan, a self-advocate, David Tollison, who used to be director of the National Down Syndrome Congress. And here we are at one of the NDSC meetings, really trying to get the word out about the work that we're doing at NIH for Down syndrome research. And so finally, I just want to thank you all for your time and attention. I'm happy to answer questions, and I want to acknowledge all of the incredible groups that are involved in this. This does not happen in a vacuum. It doesn't happen by 5 people. There are literally 50 people who are part of the Down syndrome NIH working group, as well as members of the Down syndrome consortium. All of these family organizations that are a part of what we do at NIH and help support our research mission. And of course, most importantly, we appreciate children and adults with Down syndrome and their families who help us to move forward and make progress to help improve quality of life for people with Down syndrome. So I'll close there. Thank you.
Melissa, I want to thank you for that awesome presentation. I'm sure like everyone's clapping in the background right now for you. It was a wonderful presentation. There were a few questions in the chat. In the beginning, you referenced a long, like 144-page document, and someone asked if you could put the link to that document in the chat.
I would be happy to do that. Let me just close
Okay.
down my presentation and I will find it and I'll put the link in. And that's the link to the research plan for Down syndrome research, which at NIH, we try to update about every 7 years. Why 7? I have no idea, but that's kind of the pattern we've gotten into.
Okay. Couple questions about sleep studies. So one question specifically is if a loved one that has Down syndrome sleeps quietly, should they still have a sleep study, or is it not necessary if they seem to be sleeping quietly?
That's a really good question. And, I think that there's not necessarily, a single right or wrong answer to that. I will tell you that there are situations where it can look like that, someone is sleeping well and they're not having a lot of pauses in their breathing, and they can still have evidence of sleep apnea when you do a sleep study. So I think it's really hard to tell. I mean, there are times where it's really obvious and families will come in and say, oh my gosh, my family member with Down syndrome is, snoring and gurgling and, I can hear pauses and there's a lot of outward manifestations. But there are also situations where there can be kind of more silent forms of sleep apnea. So I always refer people to, if it's a child, the American Academy of Pediatrics guidelines, which recommends starting sleep studies at the age of 4. Like I said, I know how challenging that can be to get, little kids to comply with sleep studies. And that's part of the reason why we're doing this research, to see whether there might be easier ways of getting the same information in a less invasive and disruptive way. So stay tuned. I mean, and if you talk to Marilyn Bull, who is the lead author on those guidelines for sleep studies, she will tell you that, 4 years was kind of their compromise position, but they would love to start getting sleep studies even earlier on infants and children with Down syndrome, because we think this is a problem that really starts early on. And for adults, I would say, periodic sleep studies are probably a good idea. And certainly if there's any evidence of symptoms, I would recommend getting one if you can.
Thank you. And actually, someone just put a comment in the chat that their son was a quiet sleeper who just had a sleep study done, and it did show apnea. So
Yeah, thank you for
I
sharing.
guess that goes along with what you just said. Okay, I don't know if this is something you can answer. Is there a local sleep center for adults that you could recommend, or would you say that it's better for someone to look on the DS Connect registry and see what doctors are listed?
That's a really good question. So is this for an adult with Down syndrome? So, my problem, I'm trained as a pediatrician, and so I tend to know pediatric providers a little bit better than adult providers. I will say that one suggestion I might have, for kids, there's a clinic at Children's National Medical Center and some really high quality geneticists who have seen a whole lot of young people and, pediatric aged individuals with Down syndrome. And they're really good at making referrals. For adults, I might suggest reaching out to a clinic that's based at the University of Pittsburgh. Kishore Velody runs a Down syndrome clinic along with Andrew. What's Andrew's last name? I'm going to blank on his name. I might be able to come up with that. Perhaps I can't do it right now off the top of my head. But they might have some recommendations of some good sleep doctors in this area that could provide some quality resources and feedback for you, because I know that can be a real challenge, and it's always a little bit harder to find adult providers who have expertise, I think, in treating individuals with Down syndrome.
Thank you. Okay, here's another one. If someone with Down syndrome has residual leakage at the mitral valve after heart surgery, can they still have the implant option for treatment of apnea? And this is about an adult.
Okay, an adult with Down syndrome. I don't think that's a contraindication for being considered for the hypoglossal nerve stimulator. And I think I should have checked this before the call, but I do believe that it has now been FDA approved for adults with Down syndrome to get the hypoglossal nerve stimulator. So again, this would be another opportunity to see if we can help connect you with providers in this area who have some expertise in treating sleep apnea. And what I may do after this call, I'll make a note of it, is see if I can figure out some resources. Since, we're in Montgomery County, there are a lot of great hospitals and medical providers, but I can't tell you who the best person or the best place is for adults with Down syndrome in this community per se, but I can probably look into that and try to get you all some information.
Thank you. I think you probably answered this, but if someone was interested in having their loved one, child participate in research, how would they find out about studies?
So, I would encourage everybody to sign up for DS Connect. And I know that sometimes going online and signing up for the registry, you have to answer a lot of questions. We have an initial health questionnaire that, takes a little bit of time to do, probably about 10, 15 minutes. And going through the consent process is not trivial. We were required by the Institutional Review Board to build in a lot of kind of questions that are required for that. But once you're a part of DS Connect, you are really, we will notify you if you qualify for a study that's been approved. And, I mentioned that we have over 100 studies that we've supported over the years. And I would say, so that's one way to participate in research. And a second is just to go to the DS Connect website and look up clinical studies that are available currently. And those are not every single research project related to Down syndrome is not listed on the DS Connect website, but we have filtered it specifically for NIH funded studies because there are some studies that I'm not sure I would recommend people participate in. And I think that if they're funded by the NIH, they've undergone a certain amount of scrutiny and that they've been approved by review boards that really make sure that the science is sound and that the recruitment process and procedures are reasonable and that the burden is not excessive. So for all those reasons, I would suggest going to the dsconnect.nih.gov website and checking it out and, join the registry if you can. And if you haven't already, and certainly look at clinicaltrials.gov that we have a link to. We've already done the search for you, essentially on the website. So if you see our clinical trials page, you'll find out that we've already done some of the hard work that you don't have to go to the clinicaltrials.gov site yourself.
Thank you. And, I guess the last question, but you really just answered is, are there studies on Down syndrome that aren't sponsored by NIH? And you just answered that and you said yes. But feel like
and I don't mean to say that if it's not NIH funded, it's not valid. That's certainly not my implication. But, there have been some studies that have, in particular, I'm thinking about some studies that have suggested prenatal treatments with high doses of Prozac and folic acid and some other things. And, those kinds of studies make me nervous because I don't think that they've been adequately reviewed. And I don't think that the evidence base for the utility of those studies has been established. And we don't know if there might be harms to that. So at least if there's something that's being done in an academic center where there's a lot of Down syndrome investigators and researchers, and in particular, if it's NIH funded, I'd like to believe that it's going to be a quality study and that there will be, I hope, a reasonable experience for the participants.
Thank you. I think, I hope.
So I saw somebody said something about it at Penn. They're going to be following up for 20. Is that Joanne?
Yeah.
Is that for sleep studies or for sleep apnea?
Yes, he was in the research trial that was done through CHOP.
Okay.
And we weren't even going to have him do the study because I didn't think he had sleep apnea at all. And we did the study and he was moderate, 27 times an hour.
Hmm.
So.
Well, thanks for your feedback. And that's another great place. I mean, CHOP
Yeah.
for pediatric patients and even into young
Yeah.
adults. They have a great program and a lot of researchers and experience in Down syndrome as well. So thank you for sharing your experiences.
Thank you. It looks like we have one more question. Can you comment about any studies about depression and Down syndrome? And it's someone with an adult who's asking that question.
Yeah, thank you for that. I think that some of the studies, we're not funding something specifically just on depression and adults with Down syndrome, but we are looking at some of those lifestyle factors, as I mentioned to you, and whether they might increase the risk of developing Alzheimer's disease. And certainly the ABCDS project, the Alzheimer's Biomarkers Consortium for Down syndrome, is looking at things that might be confused with Alzheimer's disease, but actually might be related to depression or anxiety. So we have to be really careful that when we think someone might have Alzheimer's disease, that we're not actually missing a really important diagnosis that could be treated, something like depression that could be treated with certain medications or with cognitive interventions and other things, or things like low thyroid levels, which can also masquerade as dementia. So there are some aspects of depression that are getting rolled into some of the studies that we're funding, particularly looking at aging and risk factors for dementia.
Thank you. I think so. In the chat is the short presentation evaluation form. If people would fill that out, that would be wonderful. This presentation is being recorded and will be posted to the DSNMC website within the next probably week, along with the slide deck from tonight's excellent presentation. I think we got all the questions in the chat, unless there's a new one. If I missed any questions, I guess unmute yourself and ask. And if not, just in the interest of time, come back often, please. Yes. Thank you for your presentation.
Thank you.
Yeah,
for
in
the
the interest of
invitation.
time, we've taken an hour of your time, and I just want to thank you so much. I think there are people here with toddlers and people here with adult children, and you spoke to everybody. And I know that everyone is going to leave here with lots of things to think about and lots of new information. And we're so lucky to have you as a partner and a neighbor. And I just want to thank you for being here again with us this year.
You're welcome. Thank you so much for the invitation. It's always a pleasure to talk with you all.